To Dr. Siegel.
Thank you. Okay.
There is your clicker.
That's forward. Forward. Okay. Could everybody stand up for just a moment? We've been sitting for a day and a half. We're going to do a moment of Qigong, so I want you to bounce on your knees, take your arms and swing them back and forth for a minute. Just get some circulation going. Woo! All right. Now, make Superman, arms nice and wide, feet apart, stretch, pull in some energy, take a nice deep breath. And now let's put our hands together with a big thank you to Dr. Weber for putting this together, for Jeremy and his wife who fed us organic food, no bad oils, all gluten-free. Is that not amazing? Do you feel wonderful? Right, not many places will walk the talk. You know, here we're talking about treating cancer, and the most important thing we can do is put good food in our body. So thank you guys for doing all that, and a massive thank you to Dr. Weber for, this is our 4th year including the fur world into his discussions, and also all the support that they give me through the years. So raise your hand if you have a dog. Very good. Can you relate to this cartoon? The dog is our therapist, and he always thinks we're wonderful. Raise your hand if you have a cat. Not so much, right? We are their servants, but you know, when they honor us with their attention, that's a good thing too. So we talk about longevity. It's a big topic on the human side right now, and people think that it's okay for their animals to age, and they think that it's okay when they die around 12 to 14 years of age. Well, this is an example of a guy in Texas who had 2 cats, made the World Guinness Book record in 2010 for a cat that lived to be 38 years and 3 days, and he had another cat that lived to be 34 years of age. These are not enigmas. He attributed these cats' longevity to the fact that he gave them some fresh food. He did feed kibble, but he gave some fresh food and 2 hours of attention to his cats every day. This is Maggie. She was a world record holder in 2016. She was 30 years. And her owner attributed her longevity to the fact that, A, she did high-intensity exercise every day. She worked on a cattle farm, a dairy farm. She had raw milk and placentas as part of her diet, and she did intermittent fasting on her own. Isn't that some of the principles that we know help longevity for us? And then this is the most current one. This is Bobby, who last month was 30 years and 266 days. He's in Portugal. I don't know a lot about his history, but he was confirmed in the Guinness World Book of Record, and his birthday is May 11th. So let's give it up for these nice longevity animals that inspire us. And this is Echo. He is 20 plus years. I want you to look. How many people know a 20-year-old cat? Not very many, right? Look at his eyes, look at the intensity and the life and the energy that's there, his coat, there's no muscle wasting. And I know his age because he's my cat. And he is, I think, 22, we tried to figure out recently, and still thriving. He's been a raw eater for over 10 years, and he's doing fantastic. So despite the fact that we have a pill for every ill and a diet for every disease in veterinary medicine, we're still seeing the highest rates of dis-ease that we've ever seen in our industry. So Dr. Tony said men are 1 out of 2. Dogs, and this is a 5-year-old statistic, 1 out of 1.65. That's almost 100% of dogs getting cancer. And this is age irrelevant. Cats, they say 1 out of 3, highly underreported, but when we include obesity, autoimmune disease, arthritis, allergies, and gastrointestinal disease, it's nearly 100% of the animals that we're seeing are having some form of illness. I tried to do a heavy metal study where we were looking at 3 categories. Absolutely healthy, never had anything wrong. The middle category had an ear infection, skin disease, little things going on, and then of course your chronic disease and autoimmune diseases and cancer. I had 1 animal in over 250 cases that I could put into category 1. And what's even more alarming is that these animals are living 7 years shorter, despite the fact that we have such advanced medicine, than they did 20 years ago. What nobody really talked about much today and yesterday was the fact that we're having so much antibiotic resistance. Everybody's seeing a problem with this now? Yes? It's becoming a global emergency. It's actually accredited by the American Medical Association that in the next 15 years, we will not have antibiotics to use in our arsenal. So it's very important that we start looking for safer, more effective alternatives, and photodynamic therapy is one of those that we could go to. Dr. Tony has his principles, this is mine. It's 6 steps to health and healing, because our objective is, what if we don't get sick to begin with? What would that be like? So number 1 is we have to stop causing the problem. We have to stop polluting the body, and that's our lifestyle. It's what we're eating and feeding to our pets. What are they drinking? What is the EMF exposure? We haven't talked about EMF, and yet that is such a devastating effect on the immune system. All the toxins that are in the household, these animals are absorbing through their skin. So when we're doing laundry in these chemicals that have a lot of xenoestrogens, even though they're not wearing clothes, they're sitting on our lap, they're laying in our bed, so they're getting a tremendous amount of absorption. Number 2 is that they have to have the essential nutrients for their body to do its job. Now, an essential nutrient is that nutrient that the body cannot produce in sufficient quantities on its own. It's not in our diets anymore, and it's not in their diets anymore. So we have to be able to supplement them. Number 3 is we have to heal the leaky gut, because we're doing so many things environmentally to cause leaky gut. If we don't repair that, we're not going to stem that rate of inflammation that's coming into the body. Number 4, detoxification of all 6 organs of elimination: kidney, colon, lungs, liver, skin, and lymphatic. I may be a little partial, but to me, the liver and the lymphatics are the 2 most important organs of detoxification, because they seem to do most of the work. Now, we address them all, but I really put a lot of attention on liver and lymphatics. Number 5, the mitochondria. We've heard so much information about mitochondria today. We need mitochondrial biogenesis. We need to make more mitochondria, and they have to be healthier and producing. But the other thing the mitochondria do is they communicate through the extracellular matrix to the microbiome. And so when we have a problem in that extracellular matrix, or we have mitochondrial dysfunction, then there's no communication happening, and that's when we get our rogue cells. And a rogue cell is simply a cell that doesn't have any communication. If we were a little isolated army and nobody was talking to us and telling us what to do, we would try to survive as well. And I think that's what Dr. Tony was explaining, is that these cells, because they don't have a good communication system, they don't know when to turn off and die, they don't know what they're supposed to do, so they just keep growing. And they're going to do anything they can to keep growing until they get a different signal. And the number 6, as Dr. Tony alluded to, is trapped emotions. Every dis-ease has trapped emotions associated with it. Now you may ask, well, what kind of emotions would a pet have? Their parents. So they are in training to the energies that their pet parent is giving off. That's not to make anybody feel guilty. If your animal has cancer, you didn't cause it per se. But when we include all of these lifestyle factors and the emotions that we're contributing, it plays a heavy role. I personally think that our fur world is that mechanism to help take the heavy 5th dimension off of us so that we can be able to function. Because when you're really sad and upset, who comes over and puts their head underneath your hand, and then you start to pet them, cat or dog, doesn't matter, and you start to feel better. So they're literally taking some of that heavy energy of this 5th dimension off of us. Make sense? Good so far? You guys are being way too quiet. Okay. This is going to be a lecture where you get to laugh, you get to cry, you get to cheer on. All right. So, thank you. All right. So I don't believe there is any disease. I think we have dis-ease. That means when the body is no longer in homeostasis, then we have an issue. And I try to keep it simple for my pet parents. There's only 3 things that are going to cause a dis-ease. 1, you have a deficiency of essential nutrients, so the body metabolically can't do its function. You have a toxicity, an overload, so that these biochemical pathways can't do their function. And then we have mitochondrial dysfunction. Now, there is that 4th component, which is the emotional component that is associated with all dis-ease. Number 2, we have to do thorough workups. This is, a lot of people think holistic medicine or alternative medicine, it's kind of woo-woo. No, we are far more diagnostic than the regular allopathic world. And it's important because we need to prove what we're doing. So some of the things that I do in my practice, full CBC chemistry, thyroid, urinalysis, that's pretty standard. X-rays, 3 views, abdomen and thorax, ultrasound if appropriate. But this is where it begins to get a little more interesting because we do heavy metal analysis on all of our patients. So we're looking for not only heavy metals, but we're looking for nutrient deficiencies in those metals. And we found in our study that I mentioned earlier that over 80% of the animals we tested were deficient in 2 or more essential nutrients: selenium, copper, calcium, magnesium, manganese. I mean, there were so many. Zinc was a big one also, and they were toxic in at least 3 to 5 heavy metals. None of these were being addressed in their therapeutic programs. And then we look at cancer markers. The lab that I work with is called VDI, so you'll hear me refer to a VDI test, and it's just the laboratory. So we do TK1. I know TK1 was used in the human world for a long time. It's not used there so much. It's not a specific marker for cancer. It also will be elevated with Lyme's disease and with osteoarthritis, but it's a great way for us to start identifying fast-growing tumors. We do CRP in dogs and haptoglobin in cats. That's our inflammatory markers. Vitamin D, magnesium, and B12. 85% of the animals tested that were eating a processed food diet were vitamin D deficient. University study. Why? Because carnivores only get vitamin D from their protein source. They do not process vitamin D through the sun. We're omnivores, we get to do both. But herbivores only process vitamin D through the sun. So if that herbivore or animal that is in that bag that your dog or cat is eating was never out in the sun, was in a feedlot, they're going to be vitamin D deficient. So why do you think we would see 85% of the animals eating processed food were vitamin D deficient? Because their diet didn't have vitamin D in it. And we know that vitamin D and magnesium are the 2 molecules that have to run the innate immune system. So can you imagine all of these cancer centers for animals that are treating $5,000 to $10,000 treating cancer cases, and their patients are vitamin D deficient, they don't know it, and they've never turned on that innate immune system? We also look at bioenergetic scanning. Dr. Tony mentioned that we're all frequency. At the end of the day, we're skin wrapped around a big energetic body. And so we're looking for those energetic imbalances that then move into the physical imbalances, and that manifests into disease. So this is used as a combination. It's not that one item is going to be the end-all be-all, but when you put the whole picture together with a good physical exam and a good history, now you start to really understand what's going on with our patients. And then thermography and CT, if indicated, those are our big ones. I just mentioned that dogs are carnivores. I don't care how you biologically slice it, they are carnivores. They were designed to kill their prey, eat it in the state that they killed it in. And if nature intended for them to be a kibble eater, they would have created some kind of process in nature that created the kibble. Nature didn't do that. So I would encourage you all to really take step number 1 and cut the processed foods out of your patients, out of your pets' lives, so that we're not creating more disease. Cats are obligate carnivores. They have no dietary requirement for a carbohydrate. Take a wild guess at how much carbohydrate is in a kibble. 50, 90, 40 to 60% depending on the brand. The more expensive the brand, the higher the carbohydrate. And it's not listed on the bag. You actually have to calculate it by subtracting from 100 all the other components, and you get your carbohydrates. A cat's biological diet is the composition of a mouse. Does not mean you need to put a mouse into your food processor, but we do need to feed them a species-appropriate diet. And as I already mentioned, we need to supply the essential vitamins and minerals, fatty acids, and aminos. We're seeing a ton of these animals on our bioenergetic scan that are amino acid deficient. Why? Because glyphosate is blocking the shikimate pathway, and consequently, we're not making the aromatic amines that our body needs in order to produce our dopamine and serotonin. And so is it a surprise that we have a society, and we're talking human side now, that has so much depression and so much anxiety? and so much suicidal thought, it's not just stress. We're literally missing these amino acids. And we're finding the same thing in our animals. We've never seen animals be more fractious and more difficult and have more anxiety than we have in the past 20 years. And I think it's directly related to glyphosate. And of course, the microbiome is so important. We need to do pre and probiotics. I do not use commercial products. I believe in nature, so we use fermented foods, whether it's sauerkraut or kefir that's homemade and really fermented. So we're talking today about laser. We didn't invent it. Nature did, God did. It's sunlight. And I think it's because we have developed into a society where most people don't even spend an hour outside. Our pets, they used to live outside. Our ancestors lived outside from dawn to dusk. They were outside. So now we're living in a society that technically is light deficient. And I think I would call it a disease because that is what's contributing to so much of our illnesses. Dr. Weber talks so much about how light comes in through our cells. It's stimulating all these biochemical pathways so that we can make energy and do all these reactions. But if you're never out in the sunlight and you're under artificial light all the time, is it a surprise that we're seeing all these diseases that are technically beginning with light deficiency? Dr. Tony and I must have been on the same wavelength because we both were describing what photobiomodulation is. But all plants photobiomodulate. So when we eat plants that have gone through photobiomodulation, we're actually eating their light energy and taking it into our body. And if those plants are organic, they are structured through the light that they go through photosynthesis, so they're structuring the water that's in that plant. And when you eat that plant, it is helping to structure the water within you. The other thing that's so important to remember is that we only heal in a parasympathetic state. If you're staying in that sympathetic tone and you're in that danger response mode, animals can't heal, we can't heal. And there are studies that actually show that red light stimulates the vagus nerve and helps to recover parasympathetic tone. That's pretty cool. You're not excited about that? Yeah. Okay. So when do we use either low light level therapy or photodynamic therapy? Just about everything. I'm just going to click through these because I can't think of a time where we wouldn't benefit even prophylactically from having more light therapy. Agreed? Yep. Agreed? Yep. Now you really got to be excited. Agreed? Yep. All right. And of course, getting down to the bottom here, including cancer. So this is how we do photodynamic therapy intravenously, intraarticularly, intralesional, and topical. Alyssa, my daughter, and I are getting a treatment in Jennifer Miele's office in Tijuana. And because I have to do everything I'm going to do to my patients. So we went out there as we were purchasing our laser and we both got treatments done. On the left and the bottom, we're doing intraarticular for a dog that had a cruciate rupture. And on the right is a little dog in kidney failure that lived another phenomenal year using photodynamic therapy. I want to touch on vitamin C because this was an area that wasn't well studied in the animal industry, and this VDI laboratory came to me and said, we want to think about doing a serum plasma concentration where we can actually measure the amount of vitamin C in the serum, in the plasma, and maybe come up with a test that we could measure on the animals. And I thought that was pretty cool. So we started looking at vitamin C in animals. Now, dogs and cats do produce vitamin C through their liver. And it's typically enough of a quantity to help them stay healthy. But the more that we studied this, the more questions that we had. What do you do if you have an animal that has challenges? Are they able to make enough vitamin C to keep up with that oxidative stress? And then if the liver is compromised, is it still able to function? And we see animals, when I started practicing 40 years ago, our liver enzymes ranged between 40 and 95. The labs have shifted to such an unhealthy population that they think that 19 on a liver enzyme is normal. So I don't know what the humans are, but 40 down to 19, that's a liver that is basically sitting there doing nothing, and it's still considered in the normal range. And then we also were looking at dogs that have liver shunts, and there was a study that was done that showed that with the liver shunt, the liver is still producing enough vitamin C. So the shunt was not affecting the production of vitamin C. Then we came up with, well, what about breeds and weight? My patients range from 5 pounds to 150 pounds. So how does that affect the treatments that you're going to be doing? And their age, of course, we see a lot of animals at different ages that are having cancer. Comorbidities, how is that going to affect everything? We have stressors, illnesses, tumor burdens, level of inflammation. What are they feeding that animal? And is it processed foods? Is it full of toxins? Do they have heavy metals, nutrient deficiencies? All of these were questions that we didn't know how to answer, and how was that going to affect the study? Oh, and I want to make one comment back here. Maybe I can't go back. So one of the things that affects your efficacy is the amount of blood supply that is actually going to the tumor. So some tumors are more walled off than others, and that's a consideration in your treatment modality, because if you're trying to do a treatment that requires that blood supply to go into that tumor to carry your photodynamic product, and it's walled off, you're not going to get a lot of penetration in there. So we had to come up with a dose and a protocol, and we knew, because we did it a few times, that if we went too fast, our patients would vomit, and if we went higher than what their bowel tolerance was, they went home with some really nasty diarrhea. Neither one of those were things that our owners were very happy about. And then we didn't know what our peak plasma concentration was going to be. We had studies that showed 3 hours, we had some that showed 5 hours, and we didn't know what the dosing was that would affect those concentrations. Now, we knew in humans that they look at 350 to 450 micrograms as being the peak plasma concentration that's in therapeutic ranges. So we knew we were going to try to aim for that. And with animals, and I don't know if this is true for people, but when we get excess vitamin C, it'll be metabolized and excreted as oxalates in the urine. Well, something that I've been seeing in the past 20 years is an increase in oxalates in dogs and cats. And it wasn't until we did this study that I realized there were a lot of companies supplementing vitamin C into the diet, and that, I think, is why we're seeing these elevated vitamin C levels. And then we have to find out how are we going to monitor it besides just looking, because some of these tumors are inside, and that's where this test was coming from, this particular lab that wanted to be able to create a plasma concentration test. So our protocol for doing our vitamin C plus photodynamic therapy was, number one, we had to get them nice and hydrated, and a lot of our patients are dehydrated. We fed them a little bit of a meal before we started the therapy so they were less nauseous. And then we made sure as much as we could that they'd already been converted into a more keto diet, which is their natural diet anyhow, but we have to get them off the carbohydrates. We did a thorough workup like I showed you earlier, and then this was probably the most important thing that we had to focus on, and that was making sure that the organs of elimination were open and working. Because if we went faster than what that body could process, we made our animals sick. And again, that's something that our parents are really not liking, is to send home an animal that's puking or having diarrhea or doesn't feel good. So we made sure that our organs of elimination were open. How many days a week could we treat? Well, I know in humans they think about Monday, Wednesday, Friday regimes, but that doesn't work well in the pet industry because A, we have to keep an IV catheter in, B, parents can't always travel back and forth. So we settled on a 2-day-a-week protocol at minimum. So it was like a Monday, Tuesday, Wednesday was detox day, and then Thursday, Friday, if the pet parents were obliging to do a 4-day process. And then we detoxed over the weekend. We strongly encourage our long-term patients to put in an IV port. I think it's similar in people. It's where it's underneath the skin, the injections go there, and it's fed down into the jugular vein, because their little peripheral veins are not going to hold up with a regime like this. And then we discovered that for most of our cases, we were having cancer cures anywhere from 5 weeks to 24 weeks. That's pretty awesome. So when you guys are energized with gratitude and happiness and joy, we're sending that vibration out into the universe. So as I'm going through these cases and they really bring your heart forward, I want you to send that out into the universe. All right, so we started with 1.5 grams per kilogram of body weight, diluted in saline. We collected our pre-samples, froze them, and then In our large dogs, it was a 4-hour infusion for vitamin C. For our smaller animals, it was a little shorter. And then we would be measuring not only our plasma concentrations, but we also measured TK1 as our cancer marker, and then our inflammatory marker, CRP for dogs, and haptoglobin for cats. So vitamin C, as we learned from Dr. Anderson, has basically a spectrum of 3 peaks over those ultraviolet blue, and it kind of ends around the yellow-green area. And we also like to use a lot of ultraviolet when we're doing vitamin C, and then we did 10 minutes with each color at 100 watts, which I'm not sure if that was the right thing to do or not, but they didn't seem to have any problems, and that was our protocol. TK1 is an enzyme that's picked up by exogenous thymidine, and it makes new DNA. So it's a marker that is upregulated with cell necrosis, not with apoptosis. So it's a great marker for us to be able to see what our tumor burden is, how well our kill efficacy on that tumor is, and what the decrease in burden is, so we know about our efficacy. This is just a diagram showing the pathway of that. And again, TK1 is destroyed with normal apoptosis, but it's upregulated with cell necrosis from cancer. So in this study, this was from the data of researchers. It showed that normal canines had a pretty average cluster of, I don't know which one's my little light thing. Okay, they cluster around the 0.2 to 0.4 region, but then we had these outliers. And again, we couldn't explain why some animals had such a high range other than it was probably in their diet. And this is just an expanded version of this. So our study started out with 57 animals, and in the pre-infusion of vitamin C, we see that they're all in the basic average range, and then post-infusion, we got them up into therapeutic range. But some of the interesting things were that if we were under 1,500 milligrams per kilogram, we had a lower response, and it didn't last as long as when we had a higher response, as indicated by this graph. So under 1,500 mg per kg, we had a lower average, and if we went higher, we had a higher average and more therapeutic. But interestingly, it actually lasted longer when we gave higher doses. So we had efficacy out to 5 hours as opposed to 3 hours. Okay, no more boring graphs. Now we're going to get into what we're really here for, and that's to see that this stuff really works. So this is Bentley. Bentley was 5 years old when I had met him, a male-neutered yellow lab, and in February he developed some blisters on his nose, as you can see. They went to their vet, they got a steroid cream, and the blisters got worse. So they went and got a biopsy, and the biopsy came back as a squamous cell carcinoma. They went to a veterinary oncologist who told them the only therapy that could do anything for this dog was to literally remove his nose, and it would not actually save him. He would only live a few more months. And per the owner's words, we ran out of there. I don't know how they found me, but they did. This was our diagnostic workup. So we taught the typical CBC Chem UA. We did the VDI panel, and this dog was vitamin D deficient. He was very low in zinc, selenium, copper, and magnesium, moderately high in strontium, antimony, mercury, and lead. No one ever identified that. We did thermography, we did live blood analysis. I like to look at the 4th phase of water, and so live blood gives me a nice way to be able to see, are we clumped or are we expanded? We did our bioenergetic scan, which is our Quest 4. We did a fecal profile, full body x-rays. During the process, we ended up re-biopsying his nose to see where we were, and at that time in July, we still had cancer cells. And then we did a CT at the end of August because the owners wanted to see, are we actually making any progress? Was it spreading? And interestingly, in August, as we go through the pictures, remember August 29th, because the radiologist could not distinguish normal versus abnormal tissue on the CT. This was the supplements that the owners gave this dog. It is an arduous supply. So, of course, we changed him to a raw diet. We have our own line of vitamins, minerals, fatty acids, and aminos, which he was on all of those. We had him on high doses of pancreatic enzymes. We have a mushroom blend that has 8 different mushrooms, so we had him on medicinal mushrooms, humic acid extract to help repair the leaky gut and the tight junctions. He was on an herbal blend, which is kind of Essiac tea with cat's claw, salvesterols. Is everybody familiar with salvesterols? Raise your hand. Only a couple of people. Really cool compound. It comes from the skin of natural fruits when it's ripening. The plants make this extract to ward off the funguses and the toxins and stuff. Has to be grown in organically because if you use pesticides, it doesn't stimulate the plant to produce these compounds. So he's on high doses of that. We had homemade kefir, B15, which is dimethylglycine. Everybody using dimethylglycine, and B17, which Dr. Tony mentioned earlier, low dose naltrexone. We had black seed oil topically and orally, along with kava oil, hemp oil, oral vitamin C supplementing the days we weren't doing IV. We did the bioenergetic imprints from his bioenergetic scan and vitamin D, and I'm sure there was a few more things that didn't fit on the slide. These were his detox and cancer therapies. And I could fill another page, right? So we start out, number one, we got to get in a parasympathetic state. So we have a PEMF device where he would go in, he would relax, he gets in a parasympathetic state. Then we did major autohemotherapy with ozone. We also did minor autohemotherapy, which is taking a little bit of his blood, succussing it with ozone. Sometimes we added some homeopathics and some viscous comp, and then we injected that back into acupuncture points. Rectal ozone on the days he wasn't getting his major autohemotherapy. Assisted lymphatic therapy was every week, along with an ion foot bath. He had vibration therapy with a sound frequency machine that we have. He had hyperbaric oxygen, which ideally would have been every day, but he was only with me 2 days a week, so we did what we could. He was in the hyperbaric chamber as much as was possible. He did a salt room therapy with us. We have a salt booth, so these lesions were all on the surface of his nose, so we were able to affect the microbiome there. We structured the air that he was breathing, so it helped to structure his body water. He had infrared therapy. The owners purchased a Weber watch, which they used at home. He also had light and gemstone therapy, chiropractic work, acupuncture. We used neoplazine, which is a derivative of bloodroot topically in the beginning to try to get these lesions to be killed back a little bit. And then we had the chlorophyll and the procyanin caps that the owners gave while the dog was getting laser therapy at home. Based on his heavy metals, we were doing a product from Quicksilver, which is liver sauce and binder, helping to pull those heavy metals out. He was on a zinc supplement because he was low in zinc. Clearway cofactors is another product from Quicksilver Scientific that helps with detoxification. All phases, phase 1, 2, and 3 of liver detoxification, but particularly phase 2 and 3. And then some IMD, which is their proprietary product for helping to pull mercury in particular. We did 5-ALA a couple of times, actually 3 times, and we did ICG in between that, intravenously and intralesional. And then he was on an anti-angiogenic, and in January of this year, we began using some Pectosol. So twice a week he came up. These owners actually lived in Michigan, but they stayed about an hour south of me during this whole time. They didn't even go back home. So that's a big commitment. They had to drive an hour and a half to get to me, wait all day long for the dog to have his therapies, and then they drove back and came back the next day. So he had high-dose vitamin C, IV curcumin, IV DMSO, IV glutathione, IV poly-MVA. We did our endo laser, and then he had major autohemotherapy and rectal ozone along with his hyperbaric. So here he is in March of 2022. You can see the lesions are getting a little more pronounced on his nose, and they went up the side and over the top. And then it was like playing a game of whack-a-mole. Every week I would come in and there's a new lesion showing up. So here you can see this one coming up right on the bridge of his nose there. This is in June of 2022. We were using neoplazine to kill back a majority of the cancer, so we had less tumor burden. And then every week there's a new lesion showing up somewhere else. He had a lesion inside of his mouth indicated by the red dot. That was gone in just a couple of months, so we were super happy about that. This is him at the end of July, and you can see these lesions are now coalescing. So it's this destructive process. So obviously all of that cancer tissue was underneath the skin, and now as we're killing it, it's just getting further back, further deeper. And then there was 1 week where we didn't do anything topical. We continued all of our IVs on a weekly basis, but 1 week we didn't do anything topical. I wanted to see what it would do, and oh my gosh, that was literally what we came into the following week. So I got more aggressive than the cancer, and I used a laser, and I surgically cut it back below the skin level and then reapplied the neoplazine. So we started doing a little bit more pivoting because we didn't seem to be getting all the way ahead of this thing. Now, mind you, labs lick everything, including their nose. So when we treated this dog topically, we had to put him under general anesthesia to leave the neoplazine on long enough. So we had to come up with this creative bandage where we put the product across the nose, put a bandage so his tongue didn't hit it. Then we had to wrap it and hold it on there. And in these particular videos, we had to actually keep him under general anesthesia that whole time, which was not a fun thing to do. I really got a lot of gray hairs. This is Bentley. This dog was the best, he's still doing great. He's the best dog ever. He knew everywhere he was supposed to go. He would jump on the equipment, and then here he is. It was time to do hyperbaric oxygen, and in he goes. Like, he really enjoyed his days with us. Yeah. And it made the owners so happy that every day when he came back, he's wagging his tail, he's running up to the front door. He doesn't even turn around and look at them. In the door he goes. Okay, we got a little faster. So this is the ALA. We used some saran wrap to hold it on. We did not get a fluorescence back when we did it. So again, it had to be under tranquilization, 3.5 hours of leaving the cream on there. But it did seem to do something good, because right after this, we ended up seeing we are photoactivating it, and his nose is looking a little bit better. This is when we did the ICG, intravenous and intralesional, photoactivated with infrared, of course. And then here he is on August 27th, and it still looks kind of ugly, but we only saw this rim that was getting to be a little ugly there. Wagging his tail. So we did ALA again. This time we really slathered it on, left it on for a long time. Just showing you the rim where we still had some lesion here and some lesion in there. And then all of a sudden, we just started noticing that it didn't seem to be growing back. So follow this. Here we are in middle of September. He's feeling fantastic. October, we're seeing regression. In November, even the pink stuff is starting to go down. We're seeing the repigmentation all the way into November. They went back home for a month, so we didn't see him. And then back in January, he's doing fantastic. The only lesion that we still had was this little spot right in here. So we redid ALA, we've done cryo on it, we've redone neoplazine, and it seems to start healing now. Everything else is looking good. This is just the graph showing the vitamin C, and then the TK1, it rises and gets smaller and smaller as we were doing treatment. The tissue burden was going down. And here he is, again, just illustrating how well he was doing. This is in February of this year. And that's the handsome boy right before we left for the trip. And this lesion seems to be healing in. So I'll see when I get home. So let's give it up for Bentley. What he taught us is that, yes, we can achieve serum therapeutic levels, that TK1 did rise with each IVC treatment, so we knew we were killing tissue cells, cancer cells, and with subsequent treatments, we could see the tissue burden going down. We did cats as well, and they seem to have a little bit more inflammation in response. So this is Chikari. She also had a squamous cell in the nose. Owner did not want to go through the traditional route. We'll go through her a little more quickly, but we did 16 weeks, a little less than we did on Bentley because she was an earlier case. What I want to point out is it started to go into the other nose. Now, that could be kind of scary. You know, your owner's coming in twice a week, going through all this therapy, and you start seeing it get really angry and go over here. And then 1 month later, it's gone. Never came back. Come on, Chikari did great. Now, as Dr. Tony pointed out, and I think Dr. Weber mentioned it, some of these animals will come out with a different cancer down the road. So the owners got a little more lax, wasn't doing as much, had some emotional things going on at home, and she developed an anal gland carcinoma a 1.5 years later, but the squamous cell never came back. This was, Riley also had a cancer. Look at all these deficiencies. He was vitamin D deficient, magnesium deficient, TK1 was normal because it wasn't growing fast. He had increased inflammation, low in zinc, magnesium, molybdenum, selenium, copper, 99th percentile of arsenic and mercury. This cat was being treated by a board-certified veterinary oncologist who never looked. So we had him another year. Here is getting his CT scan after a year, and he had great quality of life. He did transition eventually, but 1 solid year when he was told, the owners were told he'd had 2 weeks to live. And that was his graph. And these parents didn't really do a lot on him until near the end. This is Ratchet, 8-year-old male neutered bully. This is what he looked like when he came to me. He had splenic lymphoma. So here's the spleen. We started doing our treatments on him. This is his live blood at onset. It was sludge. And then after 1 hour in our pulse electromagnetic frequency machine, we have clumps. And then 3 weeks later, we see spread of his red blood cells. And that coincided with how he started feeling better. We did an ultrasound in 10 weeks, and there was no cancer in his spleen. So the radiologist said, oh, you must have not had a good diagnosis. So we went back and got the original films, which were done at a board-certified facility, and he went, wow. And that's him as he left, and he was cancer-free, remained so the rest of his life. Yay! This is Bo. He came to us from Texas. He had an anal gland carcinoma, which we removed. He went through our 10-week protocol, going through all 6 steps. And about a year, the anal gland carcinoma never came back, but he developed an oral melanoma about a 1.5 years later. And so he came back down to us. And what was so interesting about his case is the melanoma never grew. And the whole time we treated him, and there is no literature at all in veterinary medicine that has any treatment for oral melanoma. It never grew. And then this dog came to us with his oral melanoma already this big. We went through our therapies, and it melted away. I never had to take the jaw off because it literally just melted out of his mouth. But it did come back, and it started coming through the skin here, and it got pretty voluminous. However, he did not die of his cancer. That was Jim. All right, this is Tucker, 4-year-old Great Pyrenees. He was referred to us by a veterinarian. The dog was limping. They did an x-ray. He had an osteosarcoma. You can see the swelling and the proliferation of the tissue. So he has all this periosteal reaction. As we see, he was the very first dog in the United States to receive IV photodynamic therapy. Woo! And they did it intralesional as well. And here we are 4 months into treatment. We start seeing some resolution. He was walking within the first month. And then here he is in July, confirmed by the same radiologist who just thought, wow, his lesion resolved. This is Moon, 9-year-old Labradoodle who came to us straining to urinate. She had a transitional cell carcinoma, and we treated her in 5 weeks. The carcinoma was gone. She was peeing normally. However, she had a lipoma on her side, and when she came in, this thing ruptured. Now, that lipoma had been aspirated by myself and by other veterinarians for over 4 years. All they saw was fat cells, but apparently there was something more than fat cells, and our treatment actually melted it. So here you can just see the depth of this hole. What was interesting is I never used antibiotics. We did photodynamic therapy, intralesional, flushed it with ozone, hyperbaric oxygen, and it healed, but we could never get her inflammatory markers to come down, and it was because she was getting rid of her own port. So once we took the port out, thyroid came back to normal, and all the inflammation went away, and there she is, just so grateful to Alyssa for all the therapy. And she is still doing fantastic. All right, so this is just a dog. It was caught his foot in a barbed wire fence. The owner tried to treat it at home. It got infected with a Pseudomonas infection. And not that any of us couldn't treat a wound like that, but what was so interesting about this dog is, A, we didn't use any antibiotics. We did photodynamic therapy. He had fractured his toe, by the way. And so we did laser and ozone and silver. And in 7 days, this dog amputated its own broken toe, and all I had to do was go in and close it. So there I am finishing the surgery and fully healed in literally 7 days. So no antibiotics. All right, we're almost to the end. This is Ellie. She came to us. This dog had been at a referral center. She was paralyzed, degenerative disc disease, and she went to her regular vet. The vet referred her to a surgery facility, and she was supposed to have her back surgery. However, when they drew the blood, she started having all kinds of bruising. She wasn't clotting, so they said, we're not going to do that. They put in a urinary catheter, and they sent her home, and that was it. She goes, but my dog is still paralyzed. What do I do? So she came to me, and this is after our first treatment. She's able to push herself up off the ground. She still has her urinary catheter in, peeing blood, straight blood. And then that was on the 27th. This is her on the 28th. Little hoppy there, but she's getting up. This is 2 days after that. Now watch the slow-mo, because she doesn't have a normal gait. Her right hind doesn't come up as far, but you know what? She's walking. And she pulled her own urinary catheter out over the weekend. So here she is on the 31st, and again, just every day she's getting stronger and better, which was all what her mommy wanted. All of her clotting problems went away. We were doing PRP and laser on her back, along with chiropractic and acupuncture and hyperbaric, all that. And here she is on the 10th, and walking pretty good. That was Ellie. This is Bama Bear, 5-year-old Cane Corso, big dog. We went to the house for a home euthanasia, and we're going to go really fast. And we went there to euthanize, and then the owners didn't think anything could be done. We offered a option of doing PRP, so I'm not going to go through it all. Here he is in surgery. He had bilateral, so I had to do both sides. The dog could not stand up. Here he is, able to walk post-op. Here he is swimming, and his mommy's very, very happy. All right, this is Kit Kat. We got down the last couple cases. Kit Kat came in because he kept having a urinary blockage, and the owner thought she was going to express the bladder, and she ruptured it. And so on the ultrasound, you'll see the big hole right there. So we had to go in, really sick cat. And this is the hole. That's not my finger. That's the hole. And fortunately, she ruptured it in the apex of the bladder, so we were able to resect it. And with doing laser and photodynamic therapy intraoperatively and postoperatively, we worked him up. He had an E. coli in the bladder and all this hemorrhagic change. He was vitamin D deficient. B12, had really high TK1 because of all the necrotic tissue, low liver enzymes. And we did all the supportive therapy. This is him post-op, like literally just came off the table, standing up, being a happy kitty, has a urinary catheter in. 1 week later, we did a surgery to make him into a her, and he's doing great ever since. Last 2 cases, this is Tinkerbell. Tinkerbell was told, the owner was told, if you leave our clinic tonight at a referral center, this dog is going to be dead. And the owner left anyway. She had super high liver enzymes. White count was 75,000. Her bilirubin was off the charts. Her ALT was off the charts. And we did 2 full days of hyperbaric oxygen, all of our IV therapies, yada, yada, yada. It's in your notes. This is her after 72 hours, chowing down, and went home. And then I just threw this one as the last case. This is Piper, who is a 9-year-old dog that came to us with mast cell tumors on her belly and her vulvar area. So there's a couple little lesions, right? Not too bad. We treated her with neoplazine. The lesions all resolved. The owners did not keep up with her therapies, And she came back in a few months later, and this is her whole entire underside. Really, really severe. We treated her with methylene blue, and we did 2 treatments in a row. And what I wanted to show you is we didn't treat the whole area, it's too large and too much histamine release. So we just did this area, and you could see the difference in color. This is like really kind of hot red, and this is all blanched out. Sadly, the owners were very, Mommy was more into it and Daddy was very pessimistic, and the dog transitioned, but I think she would have done well. And I want to leave you with this saying, because this applies to all of us. The difference between a beginner and a master is that the beginner has failed more times than the master has failed more times than the beginner has ever tried. And as Dr. Tony said, we've all had our failures, but we've learned from them and we've moved forward. If you can't, you must, and if you must, you can. And then last is, the number one reason for failure is a lack of resourcefulness. But when you're in a group like this, there's so many resources for us to go to, it's endless. So we never have to look at our patients and say, I'm sorry, there's nothing more that we can do. There's always something that we can do.